Ever wondered how that morning cup of coffee kickstarts your day? Well, let's dive into the science of it. Caffeine, the active ingredient in your coffee, is a fast-acting stimulant. It gets to work quickly, increasing your blood pressure, heart rate, and energy levels. You see, caffeine is quite the effective booster. But how does it work? Simple. Once caffeine enters your system, it blocks the action of a neurotransmitter called adenosine. This little molecule is responsible for making you feel tired. When it's blocked, voila, you're alert and ready to tackle the day. Now let's talk timing. The peak effects of caffeine are typically felt 30 to 60 minutes after consumption. That's why you feel that surge of energy not long after your first sip of coffee. It's the caffeine doing its magic. So, your morning coffee does more than just wake you up, it sets the pace for your day. But, what happens hours after you've had your coffee? Well, caffeine has a sneaky way of sticking around in your system. It's like that guest who overstays their welcome at a party. The half-life of caffeine, the time it takes for your body to eliminate half of it, is up to 5 hours. This means even after 5 hours post your caffeine fix, about half of that caffeine is still doing its rounds in your system. And here's the kicker, this isn't a one-size-fits-all scenario. Your friend might be up all night after a late afternoon espresso while you're snoozing away after a similar cup. Why, you ask? It's because each of us metabolizes caffeine differently. Factors like age, liver function, pregnancy, and even genetics can influence how long caffeine stays in our bodies. So, next time you're downing that coffee, remember, it might just be hanging around longer than you'd think. That's why some of us are night owls while others are early birds. Ever had trouble sleeping after a late-night coffee? Caffeine, that magic elixir that gets us through the day, can be a bit of a troublemaker when it comes to our sleep. As a stimulant, caffeine increases our heart rate and blood pressure, giving us an energy boost. Sounds great for a morning pick-me-up, right? But here's the catch. The peak effects of caffeine are felt within an hour after consumption, but it can linger in the body for several hours. In fact, the half-life of caffeine is up to 5 hours. This means, even after 5 hours, half of the consumed caffeine is still running a marathon in your body. This can significantly affect your sleep, especially if consumed close to bedtime. This is why it's generally recommended to avoid caffeine at least 6 hours before hitting the hay. It's not just about being able to fall asleep, it's also about the quality of sleep you're getting. Caffeine can interfere with our deep sleep, the most restorative part of our sleep cycle. So, next time you're having trouble catching some Z's, maybe reconsider that late-night cup of joe. What about caffeine and pregnancy? Is it a good mix? Well, here's the thing. Caffeine is a stimulant that the body absorbs quickly but eliminates slowly. This is particularly important for pregnant women to consider. Medical professionals advise expectant mothers to limit their caffeine intake. Why, you might ask? It turns out that high amounts of caffeine during pregnancy can lead to an increased risk of miscarriage or birth defects. But the story doesn't end with pregnancy. Even after the baby is born, mothers should still be cautious with their caffeine consumption. Caffeine can be transferred through breast milk, potentially affecting the newborn. Remember, their little bodies are still developing, including their ability to process caffeine. So what's the takeaway here? While a cup of coffee or tea might be part of your daily routine, it's important to remember that moderation is the key. Always consult with your healthcare professional to find a balance that's right for you and your baby. So, expectant and nursing mothers, moderation is key when it comes to caffeine. Ever felt a headache or fatigue after skipping your daily coffee? That's your body experiencing caffeine withdrawal. Caffeine, being a stimulant, has a hook on your body, and when it's missing, your body reacts. Within 12 to 24 hours of your last cup of coffee, you may begin to feel the onset of withdrawal symptoms. These can include headaches, fatigue, irritability, and even depressive moods. You might also experience difficulty in concentrating or feel a bit sluggish. But don't fret, these are all temporary. Typically, these symptoms resolve themselves within 48 hours, as your body adjusts to the absence of caffeine. Yet, the experience isn't exactly pleasant, is it? So how can we avoid these discomforts? The answer lies in moderation. It's recommended to gradually decrease your caffeine intake rather than going cold turkey. This way, your body has ample time to adjust to the lower levels of caffeine, thus minimizing the withdrawal symptoms. Remember, a gradual decrease in caffeine consumption can help minimize these withdrawal symptoms. So, how much caffeine should you consume in a day? That is the question on many minds. The answer is not as much as you might think. Experts suggest limiting your daily caffeine consumption to around 300 milligrams. Now, to give you a perspective, That's roughly equivalent to 3 cups of small regular roasted coffee. But remember, caffeine isn't just in your coffee. It's also found naturally in tea, cocoa beans, and it's added artificially to many sodas and energy drinks. So, it's crucial to keep an eye on your total daily intake from all sources. It's also worth noting that the amount of caffeine in coffee or tea can vary. Factors such as brewing technique and the type of beans or leaves used can influence the caffeine content. And one more thing, while caffeine can help to increase your energy levels, it shouldn't be your only source of vitality. Regular exercise, a balanced diet, and proper sleep can all contribute to increased energy and overall well-being. It's always important to consider other ways to increase energy levels without relying solely on caffeine. So, what have we learned about caffeine? We've discovered caffeine to be a fast-acting stimulant, a quick pick-me-up that can elevate your heart rate, blood pressure, and energy levels. But remember, its effects can linger for hours, with its half-life being up to 5 hours. So half of that espresso shot you had could still be in your system 5 hours later. We've also talked about its impact on sleep. Consuming caffeine close to bedtime can disrupt your sleep, so it's wise to avoid it at least 6 hours before you hit the hay. Pregnancy and caffeine? It's a delicate balance. Expecting mothers and those who are breastfeeding should limit their intake due to potential risks. And let's not forget about withdrawal. Cutting caffeine abruptly can lead to unpleasant symptoms. It's better to gradually decrease your intake to soften the blow. Lastly, we discussed daily consumption. A good rule of thumb is to limit your caffeine intake to around 300 milligrams per day. That's about 3 cups of small, regular roasted coffee. So enjoy your cup of coffee, but always remember, everything in moderation.